So good afternoon, respected director, sir. Our expert, Dr. Keerti Jain from NIPER Raebareli, all the audience and viewers. On the behalf of ISF College of Pharmacy, Moga, I heartily welcome to our expert, Dr. Keerti Jain from NIPER Raebareli. Dr. Keerti Jain completed her B Pharm, M Pharm, and PhD from the Dr. Hari Singh Gaur University. So, and her expertise in dendrimer and nanomedicine related drug delivery systems. So, with the permission of our respected director, sir, I invite Dr. Keerti Jain to please proceed her expert talk.
There is some problem.
And
Just a minute.
please, Dr. Keerti, please uh,
Yes, yes,
switch
yes,
on your mic of
Yes,
another instrument.
yes. I have switched off now. Just to share, like my slides, I have switched on. I have
so
joined
till
from
you are
desktop.
sharing, so first of all, I am thankful to the our team. This is the ISF CP dialogue series. So from core of my heart, from ISF College of Pharmacy, I welcome Dr. Keerti Jain, and I hope that this lecture it will be the very fruitful to all the student researchers as well as the some of the professional those who are the working on nanomedicine, and I feel that this is the one of the upcoming field, and most of the doses form they are the converting in the form of the nanomedicine because of there is the number of the advantage and very beneficial to the you can say patient at a very low dose and very specific and useful for the some of the chronic and specific disease. So thank you very much, Dr. Balakdas ji, for inviting me and provide this opportunity to interact such a very dynamic young scientist, Dr. Kirti Janji. And I hope that if you have any types of the question related to this lecture, so our YouTube channel is the open. You can send your question on our chat box, and as and when our the expert they will be the available, I will discuss with you. And I feel that this types of the tech talk very useful to the all professional. So thank you very much, and over to Dr. Balakji.
Okay, sir, within second, we will continue the session. Madam Kirti, please upload your presentation.
Okay. Am I able to see? Yes.
Actually, you are logged in with two devices.
Yes. I have logged in with two devices. Actually, I'm just connecting with this, and just to upload the slide, I have connected with the desktop. It will have better connectivity. So
Okay.
I hope it is okay. Sound is okay.
Yes.
Yeah. Okay. So I'm sharing the screen. I hope the screen is visible now.
No, ma'am, right now,
No. Okay. So I'm sharing it again.
slide is not visible. So, no problem, you can take your time.
Okay. I think it is visible now.
Okay, it is visible.
Okay. Okay.
Okay, so
So
let's start.
yes. Good afternoon, everyone. So I'm thankful to ISF College of Pharmacy, the administrative team, the chairman, Sri Praveen Gargi, director and principal, Professor G.D. Gupta sir, and Dr. Balak especially for inviting me for this expert session. So when he invited me and asked the topic, what could be the possible topic? So since I think from my post graduation, I'm working on this topic that nanomedicine. So I thought this will be the best topic, and as also informed by Dr. Gupta that it is like crisp presentation with the main focus on the topic and also the design, evaluation, and applications of the nanomedicines. So before starting the research work that we carried out in on nanomedicines in our lab, first I would like to introduce the students regarding what is nanoscience, nanotechnology, nanomedicine. Because normally we get confused with like what is nanoscience, then what is nanotechnology, and what is nanomedicine. So there is like a minute, or we can say a significant difference among these terminologies that can be cleared now from this information. So starting from nano is like very small unit of maybe time, length, volume, anything. It will be like 1 millionth part of that unit. And when we say nanometer, then it is the in terms of length. So it will be equal to like 10 to the power minus 9 meters. We can understand how much small it is. And the science or the branch of science that deals with these nanomaterials having size range in the range of like 100 nanometer or less is known as nanoscience. And the beauty of these nanomaterial is that they have tailor-made properties, whether you are including like complexes, polymeric complexes or polymer drug conjugates, maybe some macromolecular structures like nanoparticles, dendrimers, carbon-based nanomaterials that may include like carbon nanotubes. All these have some tailor-made properties, means they can be engineered on their surface, they can be functionalized easily to get the different properties that range from the like biocompatibility to surface engineering for drug targeting. Then there is another term, nanotechnology. So when we are integrating all these physical, chemical, and life sciences phenomena to fabricate or process the nanomaterials or the products of in the nanometric range for potential application, then we term this product or this technology as nanotechnology. And when we are applying this nanotechnology in medicine, we call it nanomedicine. And the objective of nanomedicine is to study the nanomaterials to improve the diagnosis, control, prevention, and treatment of diseases. And that we can achieve by targeted delivery of the active ingredients that may include like pharmaceuticals, diagnostic agents, and therapeutic molecules to the target site, that is with the help of nanomaterials. So the more information regarding these nanomaterials can be found in this article, where we have compiled the information about the different nanomaterials that can be used in the nanomedicine. Broadly, we can classify these nanomaterials into three categories, that is polymeric, inorganic, and lipid-based. In polymeric, you can have like dendrimer, polymer zones. Then in inorganic, we have some metallic nanoparticles, and that also include like silver, gold nanoparticles, silica nanoparticles, iron oxide nanoparticles, as well as quantum dot, which is substance which can be significantly used in the nanotheranostics application because of its imaging ability and ability to carry the drug molecule simultaneously. Then there are many lipid-based formulation, liposome, lipid nanoparticles that include NLCs, SLN. So, and then emulsion are also there, microemulsion, nanoemulsion. In our lab, we also worked on like microemulsion, and one of the research I have also included in this presentation. So we have explored, like as I told earlier, like since my post graduation, I am working on nanomaterials and nanomedicine. So some of the research work that I'm going to discuss in like brief to give you the idea how we can design the nanomedicines, how we can use them, or how we can evaluate them. So some of the research work are summarized here, that starting from the anti-angiogenic dendrimers that I have designed at first or at the start of my like research career, and that is particularly for the targeted delivery as well as simultaneous anti-angiogenic activity in the cancer. Then we have also formulated core cell nanoparticles for oral delivery of low molecular weight heparin, and during then we have also formulated and designed ligand targeted dendrimers for intracellular targeting of antiparasitic drug to macrophages. Like there are many parasites that include like fungal protozoan parasite that form like safe harbor in the macrophages, and it is really difficult to deliver the drug molecule to the macrophages selectively. So that we try to achieve with this research work. Then currently we are also working on like microemulsion formulation. We have developed the hesperidine microemulsion formulation for treatment of neurodegenerative disorders, and also the microemulsion as well as some solid dispersion cyclodextrin formulation of bedaquiline fumarate, which is used in multi-drug resistant tuberculosis. That tuberculosis, we all know it is the national priority regarding the health in India. And bedaquiline fumarate is the only drug which is very effective in the multi-drug resistant tuberculosis. But it belongs to class 2, and we have used different strategies to solve this solubility and viability related problems associated with bedaquiline fumarate. So starting with the first research work, that is anti-angiogenic dendrimers. We have designed them as like a new dimension in the application of polymers for treatment of cancer. We know cancer is a leading cause of death worldwide. You can see the statistics here, where breast cancer has surpasses the lung cancer recently, like 2021 report, and now it is the highest, the most diagnosed cancer. So considering this, uh, first, what are the challenges? Why there is problem with the treatment, cancer treatment? So here the anti-cancer drug has narrowest therapeutic indices. It means it has in like very low doses, it is required to be used in the body, and if there is a little fluctuation in the dose, maybe on the upper side or maybe at the lower side, in both cases, what can happen when you are going above the dose that is required for therapeutic effect can lead to the side effects and very severe side effects. And if you are going, if it is not within the range and lower than the therapeutic concentration, then you will not have the therapeutic effect. Then there is high chance of emergence of resistance. And the last one and most important one is non-selective toxic effects on normal tissue. And the solution could be these two strategies, that is selective and targeted delivery of cytotoxic drug, and then combined attack on cancer tissue at more than one step. Considering this, we try to target two part of the cancer. That is, one is the proliferating cancer cells and the other one is angiogenesis. See here you can see the tumor, that is the mass of tissue formed due to abnormal, excessive, uncoordinated or autonomous as well as purple slash proliferation of cells. And that eventually can lead to death if it metastasizes and it gets malignant. So then it is termed as cancer. And this cancer or transformation from tumor to cancer is supported by the angiogenesis. And angiogenesis is the growth of new blood vessels from the pre-existing vessels. And that supports this angiogenesis by forming these new blood vessels support the tumor growth. And it is very important in transition of tumor from a dormant state to a malignant state when it is known as cancer. So the first work that I am going to discuss here, although we worked on different strategies, we synthesized like arginine conjugated PPI dendrimers for anti-angiogenic effect. One of the part I am discussing here, that is development and characterization of folate conjugated poly-L-lysine dendrimer as anti-angiogenic agent and as nanocarrier for cancer-specific delivery of anti-cancer drug doxorubicin hydrochloride. So dendrimers, poly-L-lysines have been reported that they can exert some anti-angiogenic activity, and folate receptor are highly expressed in the tumor tissue that include like breast cancer and lung cancer. So that's why we explored here folic acid to target for the targeted delivery of the doxorubicin to the cancer and used poly-L-lysine which can exert the anti-angiogenic effect. So this work was like based on like this is the previous work in which we have explored the dendrimers for the cancer targeted delivery, and we observed that yes, dendrimer has potential to target the drug to cancer cells. So this research investigation was based on the hypothesis that PLL dendrimer with a targeting agent that is folic acid could be a promising strategy to improve the anti-cancer activity of the model anti-cancer drug. And then we examined this for the anti-angiogenic in vivo and ex vivo anti-cancer activity and site-specific delivery with an objective to develop a nanoconjugate for treatment of fatal disease like cancer by targeting two parts, the cancer cells with the doxorubicin as well as angiogenesis by the anti-angiogenic activity of poly-L-lysine. So this was published in like European Journal of Pharmaceutics and Biopharmaceutics. So basically, we took PLL denlimer loaded with the doxorubicin and was conjugated with the folic acid. So doxorubicin is the anti-cancer agent. Then PLL denlimer is a nanocarrier with anti-angiogenic activity and folic acid as a target ingredient. So we took like folic acid, and the challenge was here that is folic acid has NH2 and COH group in its structure. So there could be internal linking between the folic acid molecule, where we want to conjugate folic acid with the amino group of the surface amino group of the dentin. So we protected this amino group of the folic acid with the dietibok. So here you can see we have protected this amino group with the dietibok and then reacted this free carboxylic acid group with the amino group of the dendrimers. And the reaction was facilitated by the coupling agent EDC. And this is used as a coupling agent to facilitate the reaction with the amino group with the carboxylic group. So in this way, we got the folic acid conjugated PLL dendrimer, and these dendrimers showed the nanometric size range in TEM photograph as well as in the AFM micrographs. Then here you can see that how we synthesize and then how we characterize the dendrimers, and then we evaluated. Previously, it was like characterization whether we got the dendrimers of the required size or not. Then we evaluated them for the performance, as we are claiming that it will have anti-angiogenic activity. So first we evaluated the anti-angiogenic activity of the system by CAM assay and tubule formation assay in the HUVEC cells. So we observed that we used the dose that will be not toxic to the chick embryos, and we observed that the dendrimers showed the anti-angiogenic activity that was dependent on time as well as the concentration. And here you can see that in CAM assay, that the formulation that drug-loaded folic acid conjugated dendrimer showed the anti-angiogenic activity without compromising the anti-angiogenic activity of PLL dendrimers. And then we also further confirm this activity by the human umbilical vein endothelial cells, that is HU8 cell lines, and we observed that the cells treated with the FPLL formulation didn't show the formation of the blood vessels and showed that yes, formulation has the anti-angiogenic activity. So this was the percent inhibition of tubule formulation, although that PLL, polyl lysine dendrimer, showed little more or little higher inhibition, but FPLL also showed the significant inhibition of tubule formation, confirming its anti-angiogenic activity. Then we performed the anti-cancer activity studies in the tumor-bearing mice, where we observed that the formulation showed the significant delay in the tumor growth, which was further analyzed by this Kaplan-Meier survival curve, where it was observed that formulation designed by us was able to increase the percent survival by up to the 30 days to the time to which we have observed the survival. So here, and we also evaluated it for toxicity because dendrimers have like amino group. Although we have conjugated them with the folic acid, but still we confirm whether the formulation is safe to the RBCs or not. And we observe here, you can see that in this case, you will observe that there is very negligible change in the morphology of RBCs. Whereas if you see in the case of DOX PLL or in DOX, you can see there is change in the surface morphology of the RBCs, and there is also like a clumping of the RBCs, showing that yes, that without surface engineering, there was some toxicity, not very much, but there was little, which was reduced by the folic acid conjugation. And similar results we observed in the hematological parameters, where we observed minimum change with the folic acid conjugated formulations. We also checked the weight of the Walsey mice on administration of this formulation, and we observed that minimum decrease in the weight with the formulation. So finally, we can say that the formulation could be a promising strategy as it is inhibiting angiogenesis as well as killing the proliferating cells simultaneously. So that could be helpful in further developing the formulation for the cancer treatment. The next part of the work that I will discuss in brief, that is core cell nanoparticles for oral delivery of low molecular weight lipid. Previously, we explored it for targeting. Now, in this research, we explored it for the oral delivery. So, there is a drug enoxaparin, and it is given by the parenteral route because it underwent enzymatic degradation when you give it like orally. So, considering this, we formulated this alginate coated cytogen nanoparticles for the delivery of enoxaparin on the basis of hypothesis that enoxaparin, when it is administered orally, it undergoes enzymatic degradation. But when we are formulating the chitogen or encapsulating it in the like chitogen nanoparticles, it can be delivered. But here the challenge is that chitogen resists the dissolution. This chitogen can they cannot resist the dissolution at acidic pH. So if it is not resisting the dissolution at acidic pH, the drug still will release in the gastric environment, which is not safe for the lung. So then we coated this chitogen, enoxaparin loaded chitogen nanoparticle with the sodium alginate. And finally, we got alginate coated chitogen core cell nanoparticles so that they will not dissolve at gastric pH and will not fail in delivering the drug to the intestine. So now they will protect it in the stomach and the drug will be delivered in the intestine where alginate will dissolve. So this is the steps here you can see we have used this and then we characterize this formulation for its particle size and observe that it was having the nanometer particle size range. And we performed the in vitro release study by the membrane dialysis method and simulating the gastrointestinal environment, where you know that the formulation will first encounter the gastric fluid and then intestinal fluid and then the it will go into the like from small intestine to large intestine. So we simultaneously change the pH of the media gradually to mimic the condition exactly with the gastrointestinal environment, and then we fit it with the different kinetic models. These are the same photograph where you can see that these nanoparticles were having the size range in the nanometer. You can see there is a little aggregation in the chitosan nanoparticles, but it was eliminated by the coating with the alginate. Then we performed that whether the formulation was able to deliver the enoxaparin or not, or whether the enoxaparin is active when we are loading it into the formulation. So we evaluated it for the anti-FXC activity, that is, it inhibits the factor 10, and that's why it inhibits the hemolysis. Okay, so this we have evaluated in the in vivo pharmacokinetic study, and we measured the anti-FXC activity, and with which we observed the highest with the this enoxaparin alginate chitosan nanoparticles. We have given this by the oral route, and we observed the highest activity with the enoxaparin loaded chitosan alginate coated chitosan nanoparticles. And the clotting time was also noted, and that you can see that have also been found to be improved with the this alginate coated chitosan nanoparticles, which was better than the enoxaparin given intravenously, as well as in this chitosan enoxaparin loaded chitosan nanoparticles. So finally, that coating of alginate have improved the release profile, and now we were able to deliver it into significantly into the intestine. And we observed that there was a significant enhancement in the oral bioavailability and around 60% reduction in the thrombus formation in the red venous thrombosis model. So this shows that yes, this nano medicine strategy can be explored further for the delivery of this enoxaparin for the oral delivery, which is not previously possible. So this one was published in the International Journal of Pharmaceutics. Then the next book is intracellular targeting of anti-parasitic drug to macrophages through ligand conjugated dendrimer. So you have seen like we have explored it for cancer targeted delivery, then for oral delivery, and now we also use it for the like organelle targeting. So there are different levels of targeting like first order, second order, third order targeting. So here we explore this system, or we explore nanomedicine for third level targeting, that is to the organelle. So the basic or the background work of this research work was that infectious diseases are caused by the parasite, and here with the conventional therapy, the challenge is there is chances of drug resistance. AMR, we all are listening. It is like AMR is like a like major havoc nowadays. It is one of the primary concern in the WHO listing, and also these anti-infective medicine also have serious adverse effect. So we can solve this by targeted delivery of these anti-infectious agent and by specific manipulation of immune response so that our own immunity can also fight with the infection. So here we hypothesize that there are many fungal parasites, there are protozoal parasites like Leishmania, which reside inside the macrophage. And we know on macrophages, there are mannose receptors are present. So we formulated mannose conjugated nanocarrier for the macrophage targeted delivery because mannose receptors are present on the macrophages. So these mannose-islated and here we also selected again the dendrimers so that it can be used for the targeted delivery of antiparasitic drug amphotericin B. With dendrimer, we have one more advantage that it shows the highest drug loading efficiency. It has highest payload efficiency. So we can deliver the high amount of the drug with the dendrimer. So this work was published in like antimicrobial agents and chemotherapy. And here we have evaluated this formulation in the Leishmania infection. So here the basic phenomena was, as I told you earlier, that specific manipulation of immune response can also help in fighting with the infection. So like Leishmania donovani is like protozoan parasite which causes the Leishmaniasis. So what happened when there is like infection by Leishmania donovani? If there is if this parasite causes the depression or immune depression, non-specific immune depression, and now the host immunity is not able to fight with this infectious agent or with this parasite. So we tried to formulate like MDP and mannose conjugated dendrimers, which can cause the immunostimulation of the host defense system, and now this immunostimulator will be able to stimulate the host immunity that will fight with the drug that is loaded into the dendrimer to fight with the uh, infection or the parasite within the macrophages. So these two strategies we used like mannose conjugated and MDP conjugated, and this MDP conjugated dendrimer was published in the Nanomedicine. So first, how like how we designed this carrier system. That is, first we synthesize like PPI dendrimers, and then mannose conjugated PPI dendrimers and MDP conjugated PPI dendrimers. So for PPI dendrimers, we kept synthesizing it in two steps. That first step is double Michael addition of acrylonitrile to the core, that is ethylene diamine, followed by hydrogenation. So here you can see this is double Michael addition. Ethylene diamine is reacted with the acrylonitrile, and here we got this 5.5 generation PPI dendrimers. And then the second step we used, that was the catalytic hydrogenation of terminal nitrile groups. These are the terminal nitrile groups which were hydrogenated with the raney nickel and in the presence of raney nickel, and in this way we got this first generation dendrimer, and then we repeated these two steps sequentially, that first double Michael addition and then catalytic hydrogenation to formulate the different generation of dendrimers. That you can see third generation, then we formulated the fourth generation, 4.5, and then fifth generation dendrimer that was conjugated with the first with mannose to formulate the mannose conjugated PPI dendrimers. And in this way, you can see this is the schematic presentation or the graphical presentation of the mannose conjugated dendrimer. and we found that it was also in the nanometer range, showing the size in the range of less than 50 nanometer. And then we also formulated this MDP conjugated dendrimers, and this is the scheme for presentation of MDP conjugated dendrimers. And here, this why we particularly selected this dendrimer, because you can see this multimeric presentation is possible. You can conjugate multiple groups on the surface of a single dendrimer molecule. So the multimeric presentation is important in stimulating the immunity. MDP is a immunostimulator, and when we are going for this multimeric presentation, that can help in this further boosting the immunostimulator property. So this also showed the size in more than 30 nanometer, and that you can see in this STEM micrograph as well as in AFM photograph. Then we evaluated it for cytotoxicity, cell uptake, and anti-leishmanial activity. And you can see in cytotoxicity study that amphotericin B, we know it is like a golden standard for protozoal and fungal infection. But the problem with amphotericin B is that it has toxicity issue. So we evaluated this, and here you can see that in 50 micron per ml, it is showing significant toxicity. Whereas if you see it with the MDPPA, that is MDP conjugated and mannose conjugated dendrimer, that toxicity is very less comparative to this amphotericin B. So this you can see here, and we also evaluated it for cell uptake, and with the mannose, this MDP and mannose. In both cases, you observe the higher uptake. This is due to the presence of mannose receptor, and MDP is taken up by the activated macrophages. So in this way, you can observe higher uptake in both cases. Although the PPI also improved the uptake, but the MPPI and MDPPI increase it to higher extent. Then we perform this anti-leishmanial activity with the intramacrophagic MST goat model. This leishmania parasite exists in two phases, like promastigote and MST-goat. MST-goat stage is present in the macrophage, and we observe that yes, this both the MPPI and MDPPI here, this and this are showing equivalent efficacy with the amphotericin B and envisome, that is the liposomal formulation of amphotericin B. So that you can observe here. Then drug localization index was performed to evaluate the targeting efficiency, because our objective was to target the drug to the macrophages. So that we performed, and we observed that the formulation was this MDPPI was showing the highest localization in the case of liver, that you can see here, and this was like 7, and whereas if you see it like PPIA, it was like only 0.7. You can see higher higher uptake can be observed in the case of this mannose and MDP conjugated dendrimers. So the localization index was improved more than 7 times in the case of MDPPI, and approximately 8 times in case of this MPPI, that is mannose conjugated dendrimer. So both were showing that yes, selective uptake by the macrophages. That will be more clear in this picture. Here you can see MDPPI, because what happens normally when you are giving plain amphotericin B, it goes in the kidney, like here you can see, and it can exert the toxicity. Whereas when you are giving it the MDPPI, you can see that highest amount went into the spleen and liver, which has, these are the macrophage rich organs, showing that drug is being selectively taken up by the, or these mannose conjugate and MDP conjugate dendrimers are selectively being taken up by these cells. So, and then we also performed the in vivo anti-leishmanial activity in the Balbsi mice infected with the Leishmania donidoni parasite, where you can see that the activity of the ambisome, here you can see this is the percent parasite inhibition, and the activity of this these two formulation were nearly equivalent with the ambisome formulation, even superior than ambisome formulation. So in this way, we observe that yes, the formulation has the activity, or that can be further extended for the for future application or clinical application. We are also working like micro emulsion formulations. Since the time is like about to, it's like half an hour presentation session is about to be over. So I will summarize the last two work in brief. So we have like formulated the hesperin micro emulsion, with the possibility to be used in neurodegenerative disease. And here we can see we have filed a patent in this regard, and we have also like previously published an article regarding like this potential of nanoemulsion. So we formulated aspirin microemulsion. In brief, that aspirin has neuroprotective activity, and we prepare the microemulsion using the oils, which also have, like here you can see sesame oil and orange oil, which also have this neuroprotective activity. So that can boost the neuroprotective activity of aspirin. So we formulated the microemulsion by this pseudo-ternary phase diagram, and then we evaluated it for the uptake as well as cytotoxicity, and we are planning to give it by the nose to brain delivery. So by applying into nose, we evaluated the its safety in the by nasal celiotoxicity study, where you can see this HD and ME showing the intact nasal mucosa. It is not affecting the mucosa, and also on SHSY cells, which are the target cells for this disease, or also, or this is the like blood-brain barrier cells that shows that formulation can cross these cells. So the formulation was safe up to 100 nanomolar concentration, and you can see this microemulsion was showing the highest uptake in this confocal microscope image. So conclusively, that we prepared this HDN loaded microemulsion, we found it safe toward the nasal mucosa as well as SHSY5 cells, and we observed that it can be uptaken by the SHSY5 cells. Till this, we have published this research work in Journal of Drug Delivery Science and Technology, and we are currently investigating in vitro antioxidant activity and animal imaging for the distribution of the formulation. And we are also planning to evaluate it for the particularly anti-Alzheimer activity. So the future could be that it can be developed as like therapeutic adjuvant for Alzheimer disease or as a neuroprotective nutraceutical formulation. The last one is this bedaquiline fumarate. I told you earlier that it can be used in multi-drug resistant tuberculosis. It belongs to class 2, BCS class 2, so it has poor solubility. We have evaluated here like two supersaturated drug delivery system, that is solid dispersion and beta cyclodextrin complexes, and also nano formulation, that is microemulsion and polymeric mild cells. So here this is the solid dispersion, where we observed like 2.7 and 2.30 enhancement in the bioavailability in like fasted and fed stage, and we observed like more than 250% enhancement in bioavailability. And this we have also patented this work under this patent, and we also formulated the inclusion complex, which also showed enhancement in the, but not lesser than the solid dispersion, like about twofold increase in the bioavailability that we observed, and this was also patented. And this is the microemulsion based formulation. We have performed up to like this cell uptake study that you can see here. The microemulsion was formulated with the ternary phase diagram, and we found that the emulsion was showing the size in like 29 nanometer range, and we got that yes, it is safe in the 8549 cells and also showing the uptake by the cell. So further, we are trying to like using some targeting agent that can selectively deliver it up to lung, because the parasite reside in the lung. So that's all. I would like to thank here my organization, like Raebareli, especially my students who actually performed this work, my collaborators, funding agency, and ISFCP for giving the opportunity to present this work. So thank you everyone.
Thank you, Dr. Keerti Jain. And it was a wonderful presentation of your work from IV route to the oral route, and
Oral.
with different types of nanomedicines. So I request to all the viewers and listeners, if any question is there, so please put up in your chat box. Hope we will try to resolve it, or after consultation with Dr. Keerti Jain, we will send the reply. And at the last, I request to our respected director, sir, to sum up the session or say few words.
Problem already. This is a very excellent lecture and original work of the Dr. Keerti Jain, and I am very happy to know that you are working on the cyclodextrin. So this is to inform you that we are going to organize here one of the big conference. This is
Okay.
ICS in 2026. So you will
Okay.
be one of the member of this cyclodextrin society. This is the International Society, and first time 22nd of ICS given by the society at ISF College of Pharmacy, and this conference will be the first time in India. So I hope that we can also include some of the young scientists, those who are working on the cyclodextrin and related to the cyclodextrin drug delivery system. So obviously you have given each and everything very nicely. So thank you very much for accepting our invitation and deliver a talk on the nano edition. Thank you very much and God bless you.
Thank you.
Thank you, sir. So thank you, Dr. Keerti. You can or you may leave the meeting.
Okay. Okay. Thank you.
Thank you, all the listeners and viewers.